We are taking effort to make all these things for y'all. So please y'all also make an effort to like and press the bell icon and comment if you really liked it. The code sets out common standards of conduct and behavior for those on a register. So those who have registered themselves in NMC, this code sets out common standards of conduct and behavior to them. This provides a clear, consistent, and positive message to patients, service users, colleagues about what they can expect of those who provide nursing or midwifery care. So, the patients or whoever is taking care from the healthcare team or from the nursing or the midwife, they know what they can expect from them because of this code. So they're aware. Even the people in UK and England, they're aware about their rights, about their expectations, about the standards and values and principles from this nursing code, from this NMC code. They know it, what they can expect from healthcare team. The professions we regulate have different knowledge and skills set out in three distinct standards of proficiency. They can work in diverse contexts and have different levels of autonomy and responsibility. However, all of the professions we regulate exercise professional judgment and are accountable for their work. Nurses, midwives, and nursing associates uphold the code within the limits of their competence. This means, for example, that while a nurse and a nursing associate will play different roles in as aspect of care, they will both uphold the standards in the code within contribution they make to overall care. The professional commitment to work within one's competence is a key underpinning principle of codes. See section 13, which, given the significance of its impact on public protection, should be upheld all the time. So during this code, working for NMC, working in UK, England, we have to make sure that we protect public, and that's our main motto. In addition, nurses, midwives, and nursing associates are expected to work within the limits of their competence, which may extend beyond the standards they demonstrated in order to join the register. The code should be useful for everyone who cares about good nursing and midwifery. Patients and service users and those who care for them can use it to provide feedback to nurses, midwives, and nursing associates about the care they receive. So, as I told you, the public is aware about their rights, like what care they are going to receive, in what manner, what values and standards is maintained by the nursing team, or while taking any healthcare service. This public or the patient or the members, they know that. So according to these standards, they can rate these nurses, they can give feedback according to these standards to the nurses and the nursing associates and midwives. Those on a register can use it to promote safe and effective practice in their place of work. The ones who are registered, okay, they know the standards, the values, the principles, and these healthcare team can use it at the place where they work. Employer organizations should support their staff in upholding the standards in their professional code as part of providing the quality and safety expected by service users and regulators. So the employers, whoever's organization, the healthcare organization we are working as a nurses or midwives or as a nursing associates, these employer organizations or institutions, they should support the nursing team, they should support the healthcare team to work according to these standards, so that the quality and safety of people are maintained. And also the one who is taking the services, the service users and regulators, expectations are maintained. Whatever they expect from healthcare team is maintained. This the organization should take care of. Educators can use the code to help students understand what it means to be a registered professional, and how keeping to the code helps to achieve that. So now, when as a nurse or midwife or as a nursing associates, we are studying in any educational institutions, so these educators who provide us the education, they should also use this code, so they know, so the nurses, the future nurses or midwife, or the nursing associates, they know how to behave, what to practice, how to practice, what are the standards, what are the values and principles and expectations of service users and regulators from them. Yeah, and it helps to achieve what they want to achieve by helping the service users. For the many committed and expert practitioners on our and for the many committed and expert practitioners on our register, this code should be for the many committed and expert practitioners on a register. This code should be seen as a way of reinforcing professionalism. Through revalidation, nurses, midwives, and nursing associates provide evidence of their continued ability to practice safely and effectively. The code is a central to revalidation process as a focus for professional reflection. This gives the code significance in professional life of those on our register and raises its status and importance for employers. So here it is mentioned that those who already know the code properly, those who are practicing it from since a long time, the experts or the practitioners, yeah, they should always revalidate these codes. Through revalidation, nurses, they provide evidence that this code is really helpful. They should always keep on giving importance to the code in their professional life. The code contains a series of statements that, taken together, signify what good practice by nurse, midwife, or nursing associate look like. So in this code you will find many statements. Yeah, these are not they have directly made the statement, you all are supposed to do it. When it's a statement, you cannot deny it, you have to do it, because those are the standards. Yeah, and this code, it has those statements, and they want that this code or ethics or standard should be maintained. And the statements also, they show us what a good practice should look like. It puts the interest of patients and service users first, is safe and effective, and promotes trust through professionalism. So the very first thing when we started the code, the 4 P's what we saw, that is prioritize people, practice effectively, preserve safety, promote professionalism and trust. So this code is focusing on the users, patients, service users, that is patients, yeah, their safety, then effectively those things are practiced or not, how to preserve, prioritize people, promote professionalism and trust. So the number one P is prioritize people. You put the interests of people using or needing nursing or midwife services first. What is the meaning of prioritizing people? Like, we are giving importance to the people, that is nothing but patients or service users. We give them the first place. Their expectation is our first thing which we look at. You make their care and safety your main concern. So their safety, their care, they are prioritized over there. Okay. So this NMC code, it prioritizes patients, that is people, and make sure that their dignity is preserved. Their care, the care is important thing for us. Their safety also is important thing. So whatever information we have about the patient, it should be safely kept to us. So their safety is important. Then their dignity is preserved. So we cannot disclose anything which will harm their dignity. And their needs are recognized. Whatever they want, it should be our first concern. Assessed and responded to. So we should recognize it. Whatever they need, we have to observe, recognize it, assess and respond to them. We cannot neglect them. You make sure that those receiving care are treated with respect, that their rights are upheld, and that any discriminatory attitudes and behavior towards those receiving care are challenged. You have to make sure that their rights are upheld. We have to take care of their rights. We should not discriminate. There should be no discrimination of attitude also or behavior towards them. Number 1, treat people as individuals and uphold their dignity. So these people, you have to treat them as an individual, and the dignity should be maintained. We should not discriminate. As an individual, we should look at them. Even if that patient is a small child or an elderly or one in the middle age, we should not discriminate at any point. We should just treat them as an individual. To achieve this, you must treat people with kindness, respect and compassion. Make sure you deliver the fundamentals of care effectively. The important, whatever the vital things are there, you deliver those services properly. Avoid making assumptions and recognize diversity and individual choice. We should not assume anything. Diversity will be there. There will be difference in every individual. So we should recognize it. And their individual choice. Avoid making individual choice. Avoid making assumptions, and you should recognize their individual choice. Every individual is different. Their choices are different. So we should recognize it. Make sure that any treatment, assistance or care for which you are responsible is delivered without undue delay. So if you are given any responsibility to deliver or to provide any particular care or treatment or procedure, you are supposed to do it without any delay, undue delay. Respect and uphold people's human right. You have to respect their human right. The fundamentals of care include, but are not limited to, nutrition, hydration, bladder and bowel care, physical handling, and making sure that those receiving care are kept in clean and hygienic conditions. So what the fundamental care include? Important care what include? But are not limited to means we should be careful with the nutrition, hydration, bladder, bowel care, hygiene, physical handling. Yeah. Making sure that those receiving care are kept in clean and hygiene condition. It includes making sure that those receiving care have adequate access to nutrition, and making sure that you provide help to those who are not able to feed themselves or drink fluid unaided. So it is our duty that they are hydrated, they have proper nutrition, their hygiene is maintained. And those who are not able to do this by themselves, we are supposed, or we are for that, we are supposed to help them with it. Number 2, listen to people and respond to their preferences and concern. To achieve this, you must work in partnership, respond to their preferences and work in partnership with people to make sure you deliver care effectively. You have to work in team, okay? You have to make sure that you work as a team in a healthcare so that you can deliver proper effective care. Recognize and respect the contribution that people can make to their own health and well-being. Encourage and empower people to share in decisions about their treatment and care. You should always ask them if they are allergic to something. They know, they are aware about their life rights. They are aware about their allergies. They are aware what suits them or what doesn't. So you should always communicate with them and encourage and empower to share their decisions. Respect the level to which people receiving care want to be involved in decisions about their own health, well-being and care. Now, in UK, in England, the patients or the service users, we have to take their decisions, and in picture we have to make sure that we use whatever information they have regarding themselves. They know about their own health, well-being and care. They are aware of it. We should make sure that we talk to them while doing any procedure or any treatment on them. We should tell them first, take their permission to do so. Respect, support and document a person's right to accept or refuse care and treatment. We should always respect. You should not get into any verbal fight or any verbal disagreement with patients or service users. We should support and respect, and whatever they say, if they refuse or accept the care and treatment, we should always document it. Recognize when people are anxious or in distress and respond compassionately and politely. So we should recognize that when these patients, they come to hospital, they are anxious, they are in stress, and accordingly compassionately and politely we should talk to them. Number 3, make sure that people's physical, social and psychological needs are assessed and responded to. Pay attention, special attention to promoting well-being, preventing ill health and meeting the changing health and care needs of people during all life stages. So we should pay attention, promote well-being, we should prevent ill health, We should make sure that we do all the necessary things for their well-being. Recognize and respond compassionately to the needs of those who are in the last few days and hours of life. We should always be compassionate who are left with very little time in their life. Yeah, they are on the bed death. Act in partnership with those receiving care, helping them to assess relevant health and social care information and support when they need it. We should always work hand in hand with the one who is taking care from us. Act as an advocate for vulnerable, challenging poor practice and discriminatory attitudes and behavior relating to their care. So if you come across anything which is vulnerable and poor practice or discrimination is going on, you should advocate for your patients, for your service users. You should take their side and fight for them. Yeah. Act in the best interest of people at all times. Balance the need to act in the best interest of people at all times with the requirement to respect a person's right to accept or refuse treatment. Yeah, you should always make sure that they have right to accept and refuse the treatment, so you should respect it. Make sure that you get properly informed, consent and documented before carrying out any action. So you have to take consent from them and it is documented properly. There should be a clear communication and you document everything properly. It is very important. Keep to all relevant laws about mental capacity that apply in the country in which you are practicing and make sure that rights and best interest of those who lack capacity are still at the center of decision making process. So there are some mental capacity laws and principles, so we have to consider them even when there is some problem with their psychiatric problem. Still they have some rights and best interest of those who lack capacity are still at the center of decision making process. Tell colleagues, your manager and the person receiving care if you have conscientious objection to a particular procedure and arrange for a suitably qualified colleague to take over responsibility for that person's care. So here it is given that tell your colleagues, your manager and the person receiving care if you have conscientious objection. So there is some time in the life or the service the nurses or the midwives or nursing associates, if they are not able to do a particular procedure due to any of them personal belief, so they should make sure that they tell their manager and the colleagues, and this particular procedure should be handed over to the one who can do it in a proper manner. Fifth is respect people's right to privacy and confidentiality. As a nurse, midwife or nursing associate, you owe a duty of confidentiality to all those who are receiving care. This includes making sure that they are informed about their care and that information about them is shared appropriately. To achieve this, respect a person's right to privacy in all aspects of their care. We have to respect their privacy. Make sure that people are informed about how and why information is used and shared by those who will be providing care. So the patients should be made aware about if any information is shared about their person, about their health, why it is shared, to whom it will be shared. We should make them aware of it. Respect that a person's right to privacy and confidentiality continues after they have died. Even if the patient is no more, we have to maintain the privacy. Share necessary information with other health and care professional and agencies only when the interest of patient safety and public protection override the need for confidentiality. You can only disclose the information if it is needed, if it is necessary to the healthcare providers only. If it is not necessary, you should not give the extra information about the patient. Share with people, their families, and their carers as far as the law allows the information they want or need to know about their health, care, and ongoing treatment sensitively and in a way they can understand. So, whatever is the information, whatever information about the health of the patient you are supposed to share with their immediate family members, with their families or the caregivers. You should make sure that you transmit or you communicate the information in a manner that they understand, in a proper manner. Next is, so here we finish with first one, that is prioritize people. Yeah, how we prioritize the service users, the patients, their information, how their privacy is maintained, the confidentiality is maintained, the information how we share with the health providers only when it is necessary. All this we saw in prioritize people. So all this material belongs to NMC for CBT examination. I'm just explaining the points so that it will be helpful for your self study. The next point is going to come is practice effectively. You can check the playlist or the next video.